Good morning, everybody. It is Friday, 9:30 in the morning. I have a different background, and here's my office setting for this weekend. So I have a different little place. We're live from Rocky Mount, Missouri at the Lake of the Ozarks. And we're getting ready to go back to school. So Boonville High School staff, teachers, etc., paraprofessionals, cleaning crew, all that go back Monday, August 17th. So it'll remain to be seen what happens. The students come back on August 24th, and I'll tell you what we're doing in Boonville. Morning, Eileen. Yes, it's beautiful at the lake. This is the most peaceful place on earth for me for the past 40 years. So I'm in the maybe not sole position of teaching both at a high school and on a college campus, but I go back to teaching. I've got 3 classes this semester: human anatomy and human physiology in person on the Boonville campus, and I'm on the substitute teacher list at the high school. So I'm sure this year they've been scrambling for substitute teachers in the last month, calling people. They've lifted the number of hours that a retired teacher can substitute teach, and so I guess usually they can only teach so many hours after they've retired, but they've lifted that because they want substitutes. They think that's going to be a big deal. So I'm going to give you the CDC stats, and then we're going to talk about going back to school. Those of you that are students, some of my college students watch these, and so we're going to talk about things that students and teachers can do, and actually all of us for that matter, can do to help you prevent getting this virus. So Boonville is opening. I kept thinking over the last 2 weeks that was not going to happen, and I suppose still, even at this late date, they may decide, okay, we're not doing this, and they're going to go virtual. So there's a backup plan at my community college. We have a whole section on Connect, McGraw-Hill, that we can open up and deploy in case we have to go to a virtual teaching system, which is what we did after spring break. They closed the college campus for a week after spring break, and then we went on Zoom March 30th and taught the rest of the semester. Worked pretty well. Okay, from the CDC, August 10th, 2020, worldwide, and this was in the Wall Street Journal yesterday morning. We just, and I'm outside, so you might hear dogs, who knows. 20 million cases worldwide. We surpassed 20 million cases. In the United States, specifically on testing. Total testing in the United States, 65,756,307 total tests, of which 59,867,907 were negative, for a negativity rate of 91%. Of those 65 million plus tests, positive were 5,888,400. Positivity rate was 9%. Total deaths in the U.S. are 161,842. Here come the boats. They're already skiing. So total deaths, 161,842. Death rate percent of positive tests was 2.75%. Okay, so if you get a positive test, then we can argue about what that means, because there's several different kind of tests. The one that's recommended really is a polymerase chain reaction test done on blood, and we're getting ready to offer that in St. Louis, a finger stick blood test that takes 10 minutes. So you walk in and get your finger stick, 10 minutes later you have a test result. Percent of total deaths, death rate percent of total tests is 0.25% U.S. U.S. population, 331 million. The mortality rate is 0.04%. the chance of not dying from COVID-19 is 99.96%. Okay, so I remember when this hit in February, and it seemed like it was coming to the U.S., the students at the high school, Boonville High School, were a little bit freaked out. And one of the classes that we do, the teacher, usually there's a little 10-minute CNN video that CNN does for high school students, and they started talking about COVID-19. And I think February, I think is when it was. It might have been early March, but I was still teaching face-to-face at the high school, and I was substituting for one of the teachers, and we watched CNN, and it was very obvious that the kids were nervous. And so I did that calculation, like I just did for you. I got up on the board, in front of the class on the board, and I drew out, okay, here's the world population, this, that, and the other thing. And I said, basically, your chance of dying from COVID-19, now granted this was early March probably, your chance of dying from COVID-19 as a high school student at Boonville High School is 0.00094% or something like that. I would have to do all the math again. And so that seemed to calm them down a little bit. So although it is a pandemic, the U.S. positivity rate has slowed this past week. I think 47,000 cases nationwide last week. So we are going back to school. Norman Public Schools in Oklahoma closed, going virtual. Oklahoma City Public School System totally virtual. They pushed the start date to August 30th, I believe. There are 2 rural school systems that I know of in Missouri that have gone to online, at least for the first quarter, if not the first semester, and then reevaluating. Boonville High School is going back. State Fair Community College is based in Sedalia, Missouri. Boonville's a satellite campus. There's one here at Lake of the Ozarks. There's one in Clinton, Missouri. There's 2 more, and I can't remember where they're at. So they're going back to on-campus learning. What we aren't doing in my class is in-class lab. So their laboratory, so the dissections, we do a dissection on a sheep heart and a cow eyeball and a fetal pig. And so we're not going to do that. I will maybe do a live video of a dissection on those 3 things. Those 3, I have boxes of eyeballs and hearts and fetal pigs in my classroom, or a box with all that in there. And so we're not going to do that live. They're masking on campus requirement. They closed and locked the back door. You have to come in the front door so the office staff can see you. They're not going to do temperatures, which I thought was a little bit interesting, because a lot of places, like, I went over to a physician's office in Columbia 3 months ago, and they took my temperature when I walked in the building. And if you were at 100 degrees or higher, you couldn't come in. And that was before they were mandating masks. So Boone County, City of Columbia, Missouri has mandated mask wearing. So any place you go in Columbia, you have to have a mask on. And I think that's even outside. Okay, so what are we going to do going back to school? So masks, they have hand sanitizer, and you cannot sanitize your hands enough. That's probably more important than wearing a mask. So if you sanitize your hands all the time, so carry it with you. So I'm talking to teachers and students, people are going back to the workforce, whatever. I mean, this really applies to every place, but right now we're focused on going back to school, and you're hearing about it all the time. So hand sanitizer. So students and teachers should just carry hand sanitizer in their car, in your purse. I take a briefcase to school. I'll throw some in my briefcase. And then at each class, we're going to wipe down all of the tables and chairs where the students are sitting. That's going to be one of their that's going to be something that they do. We're a small campus, so we don't have enough staff to be running around sanitizing desks and chairs. So the students are going to do that. And then there's enough time between classes. There's not going to be a mishmash of incoming and outgoing students in my lab classroom. Okay, so So we're not even going to do the little plastic model anatomy things, because we would have to sanitize them every time somebody touched, a femur bone or a heart, a heart model or whatever. So those are going to stay in the closets. Okay, so what should you do to boost your immunity? Okay, so we're going to talk about 4 or 5 different things you can do. First of all, it's probably not a bad idea before you leave to go to work or whatever, take your temperature. If it's 100 degrees, stay home. That's the CDC recommendation. So, fever, febrile illness in medicine is 38 degrees centigrade. That's 100.5 degrees Fahrenheit. The CDC is focused on anybody that's 100 degrees Fahrenheit or higher. So that'd be about 37.5 Celsius. So if you have a fever, stay home. If you start feeling like you get a fever, take your temperature. So you can carry a little digital thermometer you stick under your tongue and take your temperature. Fits in a purse or a briefcase, or in your pocket, really, for that matter. We bought one at Gerb's last week for $3.50. Works fine. Piece of cake. They have the fancy ones that are 30 and 50 and 60 and 80 and 90 on Amazon. But just a little digital thermometer. Hey Eileen. Hey Fabia. Dana. So we will take temperatures. I'll just take my temperature before I leave. And then Sarah at the high school will take that digital thermometer with her. So she'll be in the high school every day. So masking, she's going to carry Clorox wipes, wipe down the desk. She's going to leave the classroom early so she's not in the hallway. They have ceased having students go to their locker between classes. The water fountains have been taken out. You have to bring your own bottle of water if you want water. And so they're trying to decrease the congregation in the hall, like that picture you saw in that Georgia high school, typical between class hallway in a high school. And then I don't know how many cases they have, but after that picture, I'm thinking, whoa, that's going to be bad. Well, they had a bunch of cases. Okay, so what can you do to help if you get exposed and boost your immunity? Okay, so zinc. You keep hearing about zinc. Zinc is virus. It's viral protective. Zinc, simple. 15 milligrams for a student is probably reasonable, unless and it's kind of based on weight. So I've been telling my coach client adults to take 50, and then if they happen to get COVID, if they have a positive test and they're asymptomatic, I tell them to bump it up to 200 milligrams a day. Problem with that is you're going to take it with food. You have to split the dose. 50 milligrams is an easy capsule to take. I take it every morning. You can get, I think, 15s and 25s and spread it out through the day. So if you get the 200, you take a 50 milligram capsule 4 times a day and you eat something with it. The other one is vitamin D, and the base is 5,000 units. That's true almost without a pandemic. 5,000 units of vitamin D will keep you in good shape. So if you are not taking vitamin D and your vitamin D level is less than 30, you're exposing yourself to a whole host of problems, including cancer, higher risk of cancer, higher risk of cardiovascular disease, higher risk of COVID-19 that becomes symptomatic and makes you sick. Take your vitamin D. If you're a heavy person or you know your vitamin D level and it's around 30, you need 10,000 units a day. So if you're about 180 pounds or higher, maybe 10,000 units a day will do it. It's fat-soluble vitamin, so you might want to take an omega-3 fish oil, 2,000 milligrams twice a day. So 4,000 milligrams a day, and that's just heart healthy. So vitamin D and omega-3, the fish oil, help the vitamin D. They kind of help each other absorb, basically. So vitamin D is a big one. Take a multivitamin. Find yourself a good multivitamin and take one a day. Okay? You're just boosting your immunity, and you should keep doing this. I tell people to take vitamin D. All the things I'm telling you, I tell people to do all the time. And if they have inflammation, there's some other stuff. But we're going to focus on this immunity to keep you safe if you're going back to school as a teacher or as a student. Okay? So the other one is melatonin. I take 10 milligrams a day at bedtime routinely. A health coach and a professional counselor friend of mine takes 10 milligrams a day. He's been doing that for years. She also eats an avocado a day, which I think is probably a good idea. That's one of those good fats. And so melatonin, probably 4 or 5 milligrams is okay. 10 milligrams just for the anti-aging benefit and for helping you sleep is probably a better idea. And if you can't sleep, you take 20 milligrams a day at bedtime. Okay. So vitamin D, omega-3 fish oil, a multivitamin, zinc, and melatonin. That will pretty much boost your immunity. You have to eat well, stay away from sugar, cut simple carbohydrates if you can. They are addictive. It takes 3 weeks to get rid of the craving for sugar and carbohydrates if you're trying to cut them, but it's doable. And then you can do one other thing that keeps coming up is elderberry. I put up a product from Mama's Blooming Health Store. She focuses on pregnant and postpartum women, but she does have an elderberry syrup that you can order. It's not the syrup, you have to make it. And I talked to her about putting it on the shelf, and most in St. Louis, and most people I talk to say, well, we really don't want to make our syrup. We would rather just pick up a gummy or an elderberry syrup, elderberry chews. So I was in Clover, which is a natural supplement store in Columbia. I think they're nationwide. I've never been in one. They're pretty expensive, but they've got everything you can think of. And they had elderberry. If I remember, I'll put a picture of the product up when I get done. So they have an elderberry chew, I think it is. And they have elderberry syrup, and they have elderberry, something you can drink, basically, that's not syrup. So elderberry, just a supplement you take with a teaspoon, you take a swig of it. So elderberry seems to be helpful in this situation as well. Okay, so what we'll do is boost ourselves up, eat well, get some sunshine, go outside, take a walk. When you get exercise, the best exercise you got is swimming, probably. Walking is reasonable. That's pretty good. 10,000 steps a day. You just keep your health up, and if you get exposed to this virus, which you probably will, maybe you're one of the asymptomatic ones who has taken this advice and kept that thing at bay. So I'm going to enjoy the lake the rest of the day. I don't have Wi-Fi down here, so I can't work, so to speak. But what we'll do is reconvene on Monday. I haven't talked about COVID for a couple of weeks, so I thought I'd give you a worldwide and United States-wide update and things you can do, especially those of you going back to school. Teachers, students, high school students, college students, elementary school students can get this, but their transmission rate is low. One other thing that my ex-partner in Oklahoma City said a couple of days ago, I think, is that the virus can stay on paper for about, be viable on paper for about 8 hours. So teachers, if those of you that are teachers or no teachers, if you're using paper and you're collecting them, just put them in a stack and just don't pick them up until the next day. So have the students, most of the classrooms have a place for them to put their work, and you just put it in a basket and leave it alone for 24 hours and you're okay. Wipe down a desk. Hard surfaces, the virus stays for quite a while. It sounds counterintuitive because we keep worrying about droplets and all that and coughing, but it'll live on a hard surface like a desk. So that's why at State Fair we're going to wipe the desks down at the end of every class, the desks and the chairs. So that's the update. I'll come up with something that's not COVID related. I'm sure you're tired of hearing about it on Monday, and I'll see you Monday at 9:30 from Boonville. Talk to you later. Have a great day. Peace and health to you all. And I'm going to sign off. See ya. Bye.